Hello, my name is Kifah and welcome to this presentation about the core characteristic of ASD. Our mission in this life to help people, especially spectrum parents and their children, mitigate the symptoms, decrease the pain, and focus on the different aspects of ASD and how children are affected. The symptoms may be detectable from the birth, but generally appear around second year and show unexpected given when speech and prosocial activity are expected to develop. The most signs of autistic children which appear in first year, and the signs look like no geophil, no babbling, and gestures just such as waving or pointing, no sharing of sounds, and facial recognition. After 12 months, no word till 16 months, no meaningful two words or phrase till 24th month, lack of social interaction, and also shows prevalence of behavior issues. So, what is ASD mean? It is a triad of abnormal pattern of social interaction, of social communication, and flexible thinking. Also, they showed impairment in three aspects. The first one is verbal communication. Verbal communication, we can divide it to three sections. The first one is autistic. Some autistic children have rich vocabulary and they have the ability to communicate with others, interact, but all the times they talk about their prefer to talk about their favorite topic. Second section, maybe some autistic develop language but not reach the normal limit, and some of them never develop the ability to speak. In general, verbal autistic showed repetitive behavior and rigid language, saying things that no meaning or out of the context. Also, they have echolalia, that's mean repeating words over and over. They show also resistance to change. Very literal understanding or interpretation of the language. Now we can talk about the social communication, the second aspects. Social communication, that means they prefer to be alone, to be in their own words. They have lack to communicate with others. Now the third one is social cognition and refers to how they think about themselves and others in social words around them. They have difficulty to express their emotion and to interpret the emotions of others. Now, why this happen? From the neurodevelopment or neuroanatomy perspective, we can observe or spot the light on the autistic people, autistic brain, and make comparison. And we have to focus now on the four regions in the brain. The first one is corpus callosum. Corpus callosum is responsible to make connectivity between two hemispheres and associated with the complex ideas. So, decreasing in these volumes lead to decrease in these processes. Second one is caudate. Caudate here in this brain is associated or responsible for motor process, and this associated increase in this volume associated with the degree of behavior and repetitive and ritualistic behavior. Also spot a light on the amygdala. Amygdala is responsible for emotion, especially generating fear. And big size in autistic brain, that's mean or interpret that why they prefer to be isolate or the social isolation and social withdrawal. Also, frontal and temporal lobe is associated or responsible for the understanding, perception, social interaction, and also interpretation of the facial recognition. The increase of this volume lead to decrease in these process in autistic brain. Now I will give the time enough time to my group mates to talk about the other aspects of ASD, and Karen and Ashley will talk. Thank you so much and have a good day.